Welcome to the IDRPP's Time to Act Mental Health Echo. My name is Tori Coons, and I am project support for Project Echo. I have the privilege to introduce our housekeeping slide before we hear from our presenter, Jenna. I always struggle to get it to move to the next one, so let's see if I can do it. I don't think it moved yet. Give me just a second. There we go. To begin with our housekeeping slides, we record our echo sessions for educational and quality improvement purposes. By participating in this session, you are
Tori, it
consenting.
didn't move.
It did not?
No.
Okay, thank you for letting me know, because I would have just kept talking. I think it's because... Here we go. Now I can move it. I was on the wrong slide. Did you guys see that?
Yep. You're
Thank you,
good.
Janelle.
Yeah.
So, continuing on, guys. Now you can see what I'm talking about. We record our echo sessions for educational and quality improvement purposes. By participating in this session, you are consenting to being recorded. If you do not wish to be recorded, feel free to disconnect from the session. Echo is an interactive community. To help support that, we ask our participants to be engaged in asking questions after our didactic speaker and to provide feedback or ideas during our case presentation or discussion. As our discussions often surround our experiences with kids and families, please protect these individuals' privacy. We ask that you avoid using identifying information such as their name, as well as the names of family members, friends, or coworkers. If you have any questions as to what would be considered identifying information, please reach out to a hub member. All of our hub members have an asterisk before their name, or they will shortly. I too will make sure I have one, which I realized I forgot. So during each of our echo sessions, we have a subject matter expert or didactic speaker, which today we have Jenna. And then we have a case presentation or discussion. And lastly, we have professional networking. For this session, we ask that you rename your profile to your first and last name, state, job title, and organization. To rename your profile, click on the participants icon in the bottom menu of the Zoom window, your profile, and then rename your profile in the dialog box. Today, if you have questions that come up during the didactic presentation, we ask that you put them in the chat or raise your hand. Jenna said that she would be happy to talk during her presentation about any questions that you may have. Janelle will be monitoring the chat, so if you put anything in there, she will pause Jenna and we can have a conversation about it. So to use the raise hand feature in Zoom, you can hover your mouse on the Zoom window to locate the menu and then select participants and click the raise hand option at the bottom. In our echo sessions, we ask our participants to respect the presenter by using the chat or raise hand feature to ask questions or contribute. Keep questions brief and on topic. Introduce yourself and your organization before asking a question, and if you feel comfortable, to turn on your camera during sessions, as it helps with connection, building community, and making networking more meaningful. By attending this session, you can earn professional development credits. To do so, please fill out the survey that Janelle will be dropping in the chat throughout this session. Canvas is where we store all the information to prepare for, review, and implement the strategies discussed in our echo sessions. If you would like access to Canvas, email timetooact@aggies.usu.edu, and we will send you instructions for how to register. Case studies. This is our little prompt for case studies. This is where we share information about real life situations. We hear from colleagues about their recommendations for those situations, and then we receive valuable feedback to take and apply. Case studies, case presentations, they're always such a highlight of our echo sessions. And I know that we've gotten some really, really great feedback and ideas, recommendations to kind of take into our professions and the work that we do. So if you're interested in presenting a case, which we love to have our participants present for us, you can reach out to timetooact@aggies.usu.edu, and we will get the information back to you to have you present. To stay connected with everything Project Echo, you can follow our Facebook, Instagram, or LinkedIn. That's where we send out announcements or keep updated on different cool things that are happening or that we talk about in session. So thank you for participating in our USU IDRPP Echo. Without further ado, I would like to turn our time over to Jenna, who's presenting today on nutrition and mental health. And now I'm going to stop sharing and hand the time over to you, Jenna.
All right. Thank you so much, Tori. Let me share my screen. And I'll just move these out here. All right. Can you see my presenting screen?
Yes. Yes,
Okay.
I can.
Awesome. Well, thank you, Tori, for that introduction, and I am excited to be presenting to all of you today. Before we begin, I was hoping to see, and I guess Tori, you mentioned this a little bit in your introduction with their names, but if you want to put in the chat maybe what your profession is, to give me a better idea of who we have on the call today. As you're doing that, I'll just briefly watch the chat to see what you're saying. Okay. So far, we have quite the variety, which is great. Researcher, educator, a lot of educators, social work, after school. Tim, hi Tim. Tim and I are colleagues. Give a shout out. Okay, awesome. Thank you for sharing that. So I wanted to just kind of see where everyone is at in their profession. So as I go through my slides, I can kind of tailor what I'm talking about to best help you in your in the work that you do here in Utah, or if another state, if you're located in another state. But also personally as well. So I'll just do a brief introduction of who I am, the work I do, before I jump into my presentation. So my name is Jenna Dyckman. I live in Utah. I live in northern Utah, up in Logan, if you know where that is. And I work for Utah State University in the extension department. So a lot of the work I do is community based. I am a registered dietitian. I have a passion for food and nutrition. I love cooking, and so this couldn't be a better job to just talk about food all day and help people make better choices based on what I saw with all of your professions as educators and others. You are really trying to help the people you work with, your communities, probably in the specific areas that you work, just because as we help others, they have more knowledge, they feel more empowered, and they can make better choices and have a better quality of life. So within the work that I do as a dietitian, my focus area is in chronic disease prevention and management. We'll talk about chronic disease in a second, but when Janelle reached out to me asking me to present about mental health and nutrition, there's a lot of different ways you can take it. But because chronic disease is kind of my focus area, that's why I chose to focus on this. So we'll get going. A couple of objectives for my presentation today. I'll start off just talking about what we mean when we're talking about chronic disease. Then we'll dive into how chronic disease and mental health affect each other. I might have some input with you guys talking about barriers that affect chronic disease when it comes to people who are struggling with mental health, and that could be on a very large scale. We all want to have positive mental health, and the things we struggle with our mental health can be on the smaller scale, all the way to a very large scale. But no matter what, it's important that we have mental health in the conversation and are making choices each day that can help us have a good mental health. And sometimes that's easier said than done. So, and then lastly, I'll turn it over to Tori. They're going to do that case study. So that will kind of be their side of things. I'll jump off from there. So, okay. So because we have a lot of different professions, I'll just briefly talk about chronic disease. I don't think this is very new to anyone, but when I say chronic disease, this is kind of what I'm talking about. There are a lot of different chronic diseases. A lot of the work I do is in diabetes education. But we have heart disease, hypertension, obesity, and other long-term conditions that require an individual to make daily choices that really affect their long-term health. And I think that's something when we're talking about chronic disease, that it's really important to remember that it's a daily struggle. Even if they have things under control, they're feeling good, it's always in the back of their mind, and that can be kind of a drainer or draining for them and can affect someone's mental health. So if you maybe you've been diagnosed with one of these chronic diseases, or someone in your family or your close circle, you've seen how these diseases can affect our mental health, and we'll talk about that in a second. But there's really no one-time treatment for these diseases. We're just constantly trying to self-manage our disease to feel as healthy as we can, and that can be very difficult at times. Okay, so just wanted to throw just a graphic on here, just with some statistics about chronic disease, why we want to have this in our mind as we're working with other people. Maybe you don't work in healthcare and you're helping people just with their mental health, or you're helping people in a financial way, or I saw social work on there. Maybe you're helping them in just their day-to-day life. And that's really important that we have experts in all of those different areas helping people. But for me, as a dietitian, when I am working with other people, I can say, okay, you have been diagnosed with diabetes. Great. Eat this, this, and this. Go and do that. All right. See you later. And yeah, it's easy to say that, but if I don't take into consideration everything else that's going on in their life, that is not going to be helpful to them. They'll say, okay, yes, you gave me a great list of foods to eat, but I am taking care of my mom. I have 3 kids, and I have no time for myself. I don't have any time to cook. And so there's a lot of other factors that can affect their daily choices. And that can lead to burnout, both mentally and physically, and can affect how they're able to manage their chronic disease. So with chronic disease, this graphic was from a few years ago, but back in 2024, which seems longer ago than it is, about 8 in 10 people have at least one chronic disease. So about 6 to 8 people have at least one chronic disease, and 4 in 10 have 2 or more chronic diseases. And that can be any of these listed below. And then in 2022, 12% of the population had at least 5 or more chronic diseases. So that's very significant. Um, and another thing is the cost as well. So chronic disease, it can affect our quality of life. It can lead to disability, but it's also very costly for the individual and the nation as well. Okay, so what do we mean by mental health? So this is kind of some things I'll be referring to in this presentation today. Like I said earlier, there's a lot to mental health there that we could discuss, but these are some of the common concerns that we see alongside chronic disease. So things like depression, anxiety, stress. So they have a chronic disease, but now they have chronic stress that we're dealing with. And then also burnout and emotional fatigue as well. And we'll talk more. So just keep these in your mind at the moment. We're all familiar with what depression, anxiety is, of course, stress, and then burnout. So keep these in mind. And in this next slide, we're going to talk about a loop that can occur when we're combining mental health and chronic disease. Okay, so who loves roller coasters? I do. Yeah, raise your hand. I love the ones that drop, not so much the loopy ones. I kind of feel all over. Janelle, are you raising your hand for a question or for liking
No,
roller
to say I love roller coasters.
Okay. I mean, Utah, I don't know. Do we have, I guess Lagoon? I've never been to Lagoon, but they probably have some. I grew up on the East Coast and we had Busch Gardens and they have some good ones. Um, so roller coasters, they can be really fun if you're at a theme park. Um, but if you feel like you're on a roller coaster in life, that is not as fun. So I like to kind of make that analogy because on a roller coaster, you're going really fast. You really don't have any sort of control of where you're going. You're kind of getting shook all around depending on how well your restraints are. Hopefully they're good, but if you're going that fast, you're gonna be shaking all around as you're looping and dropping, and all of those different things. So if it's a true fun ride, yeah, that's a great thing. But if you feel like that all the time, that can be very draining. And if we go back to the previous slide, that's why we start to see all of those mental health side effects. If we're feeling like we're stuck in that loop, we're stuck on a roller coaster, we have no control. We're just kind of going through life and just whatever happens, happens, and hopefully we make it through. And that's what that loop can be if we're diagnosed with a chronic disease. And it's kind of a two-directional relationship. So we'll start with being diagnosed with a chronic disease and how that affects your mental health. And then we'll switch that perspective. So if let's say, you aren't feeling super great, you're going to the doctor for just a yearly checkup, and the results come back and they say, oh, you have diabetes or pre-diabetes. You'll need to change your eating patterns, be more physically active, and come back in 3 months. We'll run some more tests, see how it went. And then they just send you on your way. That can be really stressful. A lot of the patients or people I work with, whether it's one-on-one or in a class setting, that's where they're at. And that's not really helpful to receive that diagnosis and then no direction. It's kind of just sending them on to that roller coaster and saying, okay, have fun, good luck. Um, and what we can do as providers, or even uh, if you're working in the school system or as a social worker, if they open up to you and say, "Hey, I just received this diagnosis. I don't really know what to do from here." You already know a lot of other different things going on in their life. You can say, "Hey, here's some tools that you can um, use to get the help you need." And a great resource is referring them to a dietitian. So I'm not just saying that because I am a dietitian, but as registered dietitians, they are nutrition experts, and we had our schooling and our training in order to help people manage a variety of situations when it comes to their health and nutritional concerns. And so you can help them work with their doctor, or at least encourage them to talk to their healthcare provider to get a referral to a dietitian. And oftentimes, especially if it's related to a chronic disease diagnosis, if they have insurance will cover at least a few visits per year, depending on their insurance. So that's something that you can educate them on, and that can help them feel like they're able to get off that roller coaster and have some more control in their life. Okay, and then on the flip side, so if we flip that arrow, so, well, I get, anyway, if they are struggling with their mental health and they haven't been able to have any sort of help related to that, maybe they are having those symptoms of depression, they're feeling burnt out with their life, whatever it might be, um, taking care of themselves, making healthy choices, being physically active might not be a priority. And if that's a long-term lifestyle, that can increase their risk for chronic disease. If they're not eating well, if they're not being physically active, their mental health, the things they're dealing with as they have struggles with their mental health can affect them physically as well. So helping them get the care they need for their mental health can help them feel more empowered to get back to a healthier daily routine, manage their symptoms, whether it's depression, anxiety, their stress levels. Because I'm sure all of you on the call, you're here because you know how important mental health is and how it can really affect our overall day-to-day choices. And just in that last bullet point, they really can intensify each other. So we want to make sure they can get the help they need as quickly as they can to prevent long-term effects. Okay, so I guess I talked about this a little bit. I just kind of got on a roll. Loved the roller coaster picture, so we had to stay on that slide. Just a few more things related to mental health affecting chronic disease. So in this case, let's say they do have a chronic disease. And they're having a lower mental health day, or their mental health isn't as great in this period of time, they might have had, we'll just stick with diabetes since I've been talking about that. They might have had diabetes for 5 or 10 years, and they know what to do. They know the recommendations. They've been really good about meeting with the dietitian or going to their healthcare provider regularly to help with that monitoring to make sure they're doing well. But then for whatever reason, whatever's causing that effect on their mental health, they have a more difficult time following those recommendations. Maybe they have lower motivation or energy, and so they're missing appointments. And that can be how mental health can affect chronic disease. Another thing too, so if it's a new diagnosis, some people I've met with when they're newly diagnosed with a chronic disease, some people say, after I received that diagnosis, I just didn't eat for a couple of days, or I didn't eat very much for a few weeks because I was just really afraid to eat. I didn't know if I was eating bad things. And so a dietitian can really help them know what they can and can't eat to prevent that shame or guilt, and not think, oh, if I'm not doing everything perfect, then I'm not managing my diabetes or my chronic disease successfully. Any questions in the chat? I'll just see. Okay, no, all right. And then on the other side, and I talked about this a little bit, maybe over time, if someone is dealing with a chronic disease, there could be a slow burnout, or fatigue might start to creep in. Because in an earlier slide, I talked about how managing a chronic disease successfully isn't just a one-time thing. It's something that a person has to make daily choices, and that can cause decision fatigue. If they uh, aren't able to make the best choices over a period of time, they might have that fear of complications, and then they might just have that feeling of being overwhelmed. So that's why we really see that loop with chronic disease and mental health. So we really want people feeling empowered, like this top picture, and not feeling shame or guilt or fatigue. We want them to be able to really manage that chronic disease successfully. Okay, so what can we do as providers, as family members, friends? There's a lot that we can actually do, even if we aren't an expert in nutrition, if we're not a doctor. Finding that community can be really helpful. And I think this is important for mental health in general. As maybe you've had other sessions about this, about the importance of having good social, emotional health, and how it can really boost that mental health. So supporting your friends or your family members as they're going through these times can be helpful. And one way we can do this is by normalizing their challenges. So, for example, if they're opening up to you about something, don't act super surprised or saying, "Oh, why are you struggling with that? That shouldn't be something you're struggling with," or making them feel like they're the only ones that is struggling with that challenge. Instead, maybe asking them more questions about how it's affecting them, or what that challenge feels like, or if you've had a personal experience with that challenge, sharing that with them. And that can really help to benefit them and build that community. And maybe you're struggling with something you didn't realize, and that can support you as well. And then using strength-based language. So even if they are sharing the challenge with you, trying to listen and hear them, I think that's important. but then also helping them to get through those challenges in a positive way. And that's hard to do sometimes. So you kind of have to see where they're at. Of course, if they're dealing with a lot of depression and anxiety, saying, oh, just we can be happy and that'll be good. That might not be the best thing, but focusing on things that they are doing well. Sometimes if you're feeling down, your mental health is really struggling, it's hard for you to have that perspective of what you're doing right. And so helping them to see that in a way that works for them is helpful. So you kind of have to gauge where they're at and what would be helpful, and use that language appropriately. And then also, another great thing is to help them focus on small, achievable steps. This can be at any point in their journey, especially when someone is newly diagnosed with a chronic disease. Um, if they're meeting with a dietitian, uh, they might have a lot of different things they have to work on to help them be at a point that they can manage their chronic disease successfully. Um, but you, and I mean, a lot of you probably have had this experience, especially it being the new year. Maybe for your New Year's resolutions, you made 5, 10, 20 New Year's resolutions. And you've probably all had an experience of making those New Year's resolutions, and maybe by January 21st, which is today, you forgot most of them, or you've put them out in the wind and said, maybe next year. But if you set maybe 1 or 2 New Year's resolutions, that's a lot easier to achieve and work on a daily basis. And that's what you want to do with chronic disease. So looking at what you want to first work on, what would work with your schedule, with your current frame of mind even, and say, okay, today I'm going to work on this. Uh, for example, eating veggies is a great way to manage a lot of different chronic diseases. There's a lot of great um, nutrients and benefits of vegetables with chronic disease management. And so let's say if you're only eating 1 or 2 servings of vegetables today or in a day, your goal could be to increase that by 1 more every day. Or you could even say, okay, in this next week, I'm going to try to have at least 2 servings of veggies or 3 servings of veggies 3 times this week. So hopefully you can see how that focusing on those small changes will help to make a sustainable lifestyle that's healthy, and that could benefit mental health and your physical health as well. Asking open-ended questions is another really great thing. I don't know if you've ever been in an interview or other situation where you're trying to have a conversation and someone is, or maybe you're doing this, someone's asking you just yes or no questions. It's hard to get the conversation going, but if you ask it in a way where it gives someone the opportunity to share how they're feeling, and expound, even if might be a little hard for them to share, that can be a way to show them that you're interested in what they're going through and wanting to have that conversation. And then the last one about routines versus perfection, that kind of goes back to your small achievable goals. So when it comes to building a healthy, sustainable lifestyle, you want it to be more about routines than being fully perfect. My coworker actually, she shared this that someone told her. And so they said that one meal isn't going to, if you're one healthy meal isn't going to make you a healthy person. One unhealthy meal isn't going to make you an unhealthy person. And that even expands to one healthy day isn't going to make you um, a healthy person, or one unhealthy day of eating or whatever isn't going to cause you to have all of the chronic diseases. It's all about what is your overall routine, what's your progress looking like. So if you aren't having that perfect meal for every meal, that perfect day, that's not the end of the world. It's all about where we're going and where we want to be. And if we're slowly reaching that, even if it's a up and down progress, as long as that up and down is slowly getting higher and higher, that's really what we want to achieve. So I wanted to throw this in just because you might be working with people in your job, in your personal life, and sometimes it's helpful to think about how to say things as well. One thing that in the last, I don't know how many years, but um, more recently, they've, especially in nutrition, but I feel like in other areas of health and other professions, they focus more on that person-centered language. So, for example, saying, oh, that person's diabetic, saying, oh, that person, that individual with diabetes, or that child is autistic, saying that child who has autism, things like that. As we're just reframing how we're saying that, it helps people remember that their disease, that condition, it doesn't define who they are. And I think that really helps with mental health as well. Just reframing how we're thinking about who we are, what defines us. And if we just have that condition, we just have that disease, we still have control over that. We can make choices to help us manage it, and that's not managing us. So taking some time to think about what type of people you're working with in your profession or in your personal life, and thinking how you can use more person-centered language with those people can be helpful. Some other statements or questions that you can ask just to get the conversation going, or to help them think about what they're going through at this moment, and help them not feel alone. So one is, managing this condition can feel overwhelming. Many people feel that way. And so that goes back to our previous slide. I'll just go back, of normalizing the challenges. So mental health, you might feel kind of secluded. I'm the only one going through this. But saying just simply, you're not alone, can be helpful. Another thing from the previous slide, we talked about, oh, whoops, let's see. Oh yeah, so making small, achievable steps. So asking them what feels most manageable right now. That can be a great question to see where they're at and what they are able to do. What has worked for you in the past? That could be another way to help them think about what they can achieve at this time. And then what it would be helpful to focus on. Oh, sorry. The last two questions started with what, so I just went with that. Would it be helpful to focus on one small change? So hopefully this would be a good question to see if they're even open to making changes at this time. One thing too, a lot of dietitians, they use the theory, or the the stages of change. I don't know if anyone else is familiar with that, but kind of helping people assess, uh, help them, but also help us know where they're even at in their journey. Some people, I should have put this on here. I'm trying to think of there's the 5 different ones. Oh, okay. Pre-contemplation, contemplation, action, I think. And then, sorry, I wasn't thinking about this when I created this presentation, but it just came to me, so I thought I'd mention it. So I can maybe put a slide in here when I send the slides to Tori, just so you can see the correct information. But pre-contemplation would be the person's not even thinking about it. They're not even open to taking any action at this time, but helping them even think, oh, maybe I do have something I need to start working on. That's a step in the right direction. Whereas contemplation, they've been thinking, oh, I need to start making some changes. I need to get help with my chronic disease or even my mental health. I don't feel like taking any action right now, but maybe at one point I want to do that. That would be more of that contemplation. And then eventually they're open to making changes, and then they're on their way to taking action, and then eventually just sustaining those changes that they've made. So the stages of change can be a helpful tool as well. All right. So just let me, hopefully it doesn't, oh, okay. Bring that back up. So just in summary, I really appreciate all of you being on this call today as we talk more about how chronic disease can affect our overall mental health and vice versa. They are very connected. And as we learned earlier in the presentation today, many people are affected by chronic disease. Whether you personally have chronic disease, a family member, a friend has chronic disease, we all can do our part to either help ourselves or help others with managing their chronic disease. And that can help our overall mental health. And we want to remember that we don't ever want to feel out of control. That's what can lead to those mental health symptoms of feeling depressed or having anxiety, feeling burnout, fatigue. And if we get to that point, it's important to either help ourselves or ask for help, or if we're seeing that in others, really help them get the support that they need. And in the work that you do, you don't have to be a nutrition expert. You don't have to be a mental health expert, but you're a person, how to observe others. You can see what they're going through, especially if you work with them closely, and taking time to ask them questions, have that conversation, and use that person-centered language can really help them either open up or eventually be ready to open up to you. So collaborating with your colleagues and working within the community can help to build that environment of support wherever you might be. So that's all I have. I'm happy to answer any questions. Or if there's no questions, I can turn it back to Tori.
Thank you, Jenna, so much for that presentation. I found it very enlightening. If anybody has any questions, you're welcome to type it in the chat and we can read it out loud, or you're welcome to raise your hand or come off mute.
Hey, Jenna, this is Kurt. Just a quick question for you. I mean, you touched on obviously the importance of healthy diet and eating and lifestyles and that. Are there any really good websites that you could turn people to? Because I know because of the stigma that goes along with mental illness, some people aren't willing to go and talk to somebody in person or to seek out mental health counseling or even dietetics around mental health. Are there good websites for that you could point somebody to? Because I think a lot of people want to try to manage themselves initially, it seems like. And then if that doesn't work, then they might go to that next step. I mean, I'm a physical therapist and people are always like, okay, I've got a bad back. What exercise can I do? And I could give them a few, here's some good websites or here's some things to start with. But eventually you may want to get in and see a professional about it. Do you have any of those websites or resources you can pull off the top of your head and give us maybe a couple of good resources we could help share with other people?
Yeah, great question. Are you thinking more resources where they can go and just read articles or places where they can meet with someone online?
I'm more talking about kind of those self-help ones, where they can
Okay.
go read the
Yeah.
research, read what people are saying. Because I mean, you always get stuff like the news will say, oh, well, this helps this and this helps this.
Yes.
But I'd like to go a little bit more technical than that, maybe before I'd start be comfortable handing a resource to someone.
Yes. Uh, I'll put a few in the slides before I send them to Tori, just so you can reference that. But one, since I work for USU Extension, if you just Google USU Extension and then the topic, we have a variety of different articles. I guess I didn't talk about this at the beginning, but USU Extension, we have a variety of different experts working across the state of Utah. Um, we have people in mental health, nutrition, family relationships, things like that. So just even the USU Extension website, you can browse through there and find specific articles that could be helpful. But I'll put some more in the chat related to mental health and nutrition, and just so you have those and don't have to write them all down. But
Hey, Jenna, I hope I'm not interrupting. We have a question in the chat. Is now an okay time to ask that?
yeah, of course.
Okay, so Emily asked if there's any tips or you have any tips for a parent talking to their child about their chronic illness and maybe why they are eating differently.
Yeah, that's a really good question. And kids are a lot different than adults. Uh, I'm just going to scroll to the question so I make sure I remember all of it. Um, so with kids, especially depending on their age, if it's like a younger kid, not even a teenager, um, really emphasizing the changes as a family and not singling them out can be really helpful. So, you may want to sit down with them and just educate them about nutrition choices, especially if they're a teenager and they're more trying to be independent and maybe they eat lunch on their own, or if they're at an age where they're choosing their after school snack or things like that, having times where you're helping them get that nutrition education. But even with the nutrition education, if you can frame it as a family thing, maybe doing something fun, uh, going on a family. So if the child needs to be more physically active, doing things as a family, and then doing some meal planning together where the kids get to choose, and then maybe you have a my plate graphic or something like that where you say, okay, we need all the different food groups in our meal. What should we have? Just trying to make it more fun rather than, all right, well, you have this chronic illness. It's because if you frame it that way, it might be more stressful to them. They might internalize things and think about, oh, am I doing something wrong? And you don't want that ever to happen, especially with a child. So, anyway, hopefully that answers it a little bit, but I would say summary, just framing it as a family change rather than just that child.
That was a beautiful answer. Thank you.
Yeah.
If anybody else has any questions, feel free to again drop it in the chat, raise your hand, or come off mute.
All right, I have a quick question for Jenna. So, Jenna, one of the questions that I have is, as you kind of brought up in the beginning of your presentation, and you talked about, and you highlighted some of the chronic illnesses that that can be more common. And we look at some of those, a lot of the tendencies that people have, as Kurt said, is to self-treat before they seek out providers or professionals with those. And a lot of times the first thing we do is we go to the physical, right? Well, I'll just exercise, and they do see a doctor, they get that kind of predetermination, and it's like, okay, well, the first thing is I'm going to try and exercise. And a lot of times we don't see that work out because people just don't have the time or the capacity or maybe the motivation, right? And then so that fails, or they struggle to do it, or whatever the reasons, right? And then we get some of those mental health aspects, and so we get the therapy thing that comes into it, and maybe we struggle for various reasons to try and get the mental health thing in there. So I guess the part that I wanted to bring into it is multi-factor providers, right? So when we look at some of these types of things like chronic health, it's one of those things that doesn't go away, which is why we call it chronic. And when we're looking at the impacts, it's probably multi-dynamic. It's going to take a little bit of everything. So from your perspective, can you kind of speak to, when we're looking at, how do I kind of best tackle this? Like, is there maybe a way to go that's a little bit more successful long term, if we're going at like, here, if I kind of go at this direction, is this a little bit more successful in kind of building that provider base, or maybe building that way of being able to help with that success of maybe building that foundation for coming at this and making a healthy mental health and physical health and way to be able to move through this?
Yeah, that is a really, really great question. And I wish I had one perfect solution, and I feel like if we did, um, it would be implemented everywhere, and we would have hopefully maybe a little bit better handle on chronic disease. But I think, like you said, because there's so many different facets to someone even just getting a chronic disease diagnosis, what causes that. Um, the best thing they can do is really try to have help from a lot of different sides. As you were talking, I was kind of thinking about the social determinants of health and how that can affect someone's just everything about them. So yes, they have a chronic disease. Maybe it's because they're not making the best food choices, they're not as active, but what is causing that? Are they in a food desert? Are they living in a place where they can't really be active? It's dangerous to just walk out on the streets. Maybe they're a single parent and they have two jobs and they're trying to support their kids. So I can't say, I don't know for sure because every case is different, but I think it just goes back to what you said of helping them see that they might need help from a lot of different places. And just because one thing failed doesn't mean they can't find success in that journey, because it's a long-term journey rather than just a couple of changes and then they're gonna reach their goals. So sorry, it's not a better answer, but that's all I got.
Thank you, Jenna. We have a couple more minutes that we can have more questions if anybody has them. If nobody else does, I've been thinking of one where there's so many hard, just hard things to like deal with when it comes to chronic illnesses that like kind of just like affect how we like have a relationship with our body, and whether that be like with nutrition and different things. Have you found like any ways that really helped somebody have like a more appreciative view of their body and what it does for them even as they face all of these hard challenges and difficulties? I'm not sure
Yeah,
if that made sense, so I'm sorry if I phrased that confusingly.
no, that's good. And yeah, I can answer that. So um I think when it comes to body image, there's a lot that affects that. Their history, how they've thought about their body throughout their life, if have they had any influences of people commenting about their body for good or for bad. That can really affect someone's view on their body. And I think it also comes to their relationship with food as well. Um, because food is our fuel. We want to eat healthy, but there's so many things tied to food as well. There's memories, our culture, just our taste preferences, social society is revolves around food a lot, even just being at work. And if someone brings in a treat they made, or there's food in the break room, that can, if someone has a chronic disease, they have to think about, can I eat this food? And it might bring stress on them to say, oh, I can't really eat that, but I don't want people to ask questions about this. Or so I think helping people just still have a good relationship with food. When I meet with people and we talk about making those small sustainable changes, I just try to remind them that we don't want to label foods as good or bad. And it's all about making the best choices we can in the circumstances. And that can really alleviate a lot of guilt that they might feel, which in turn can affect your physical health and your physical image. Um, so I think really just having that, striving to have that good relationship with food, because no matter who you are, I think that can be just a tricky thing. So
Yeah, that was a perfect answer. Again, I'm just gonna give another opportunity for anyone to ask a question if they have it.
I do like the comment about the Head Start families. I agree. They impact their children. And so if parents are able to make good choices, and even kind of going back to your question, Tori, um, if parents aren't commenting about their children's body or their physical appearance, or maybe their choices, and they're framing it as, let's do this as a family, that can set them up for success to have a better body image, better health choices in the long run. So yeah, thanks for that comment.
Let's give everyone a couple more seconds if they need to chime in or want to chime in. Serenade just commented, sometimes it is hard to support kids when the whole household struggles. Any tips for helping parents understand their household habits are not healthy and there is concern?
Well, that's a good question. Uh, let's see. I guess it kind of depends on what kind of relationship you have with the parents. Um, if it's in a work setting, if you're just meeting them on a one-time basis, uh, I guess you could kind of use the stages of change theory, and maybe I'll put that on my slides too, with that resources of just identifying to see, okay. Oh, okay. So if you're a school nurse, you could always, I don't know, the kid might lose a flyer, so flyers might not be a great thing. If you're able to meet with the parents, maybe having a opportunity to give some education. There's a lot, yeah, we could probably have a whole other presentation, but maybe working with your administrators to send out emails with ideas of how to have a healthy home. That would be a hard one if you're not meeting with the parents regularly, or if it's just a one-time meeting. Yeah, there could be a lot. So I'm happy to put my email in the chat too if you want to. Oh yeah, there you go. Parent nights. Yeah, taking advantage of the parent nights could be good. So yeah, there you go. Thanks, Stacy.
Thank you everyone for your comments and your questions. I think we've had a really great discussion. And I wanted to again thank Jenna for her presentation. I know I learned a lot, and I think this is a very important topic to discuss. We are going to move right into our case presentation for today, where we're going to have Rebecca presenting for us. I am going to share my screen. And so if somebody could let me know. Nope, it's not the right one. I knew that was going to happen. There we go. That should be good. And then Rebecca, if you just want to tell me when you would like me to move to the next slide, that would be great.
Awesome. Yeah, so after case presentation, you can skip to the next slide. Hi, folks. Something that's been on my mind that I've been considering for a client of mine, wanted your feedback on it. So just as a background on Han, a 40-year-old non-binary individual, they grew up in South America, diagnosed with dissociative identity disorder 15 years ago, first memories of different alters during teenage years. So what I've been talking about with this is many of our conversations have been about how it's difficult for them to have a long-term job because there would be one alter fronting going through their day-to-day, and then without notice, they'll switch to a different alter throughout the day, and there's no connection to memories between these alters for the most part. So it's difficult to stay doing a job responsibility. So that's one thing in there. Years of experience, they are really good with art. They use art as an outlet and kind of a way to express themselves. I can go to the next slide. Something helpful to kind of know for like relationship wise, unsupportive parents, was divorced a couple years ago, emotional, physical, and sexual abuse with ex as well. They have a child. They're about 8 years old, so a child in the home. They also co-parent with their ex, and so they have their child in the home every other week for about a week. And coping strategies at the moment, they often switch when they're having a difficult time. And we've had conversations about housing needs, job needs, just in general, coming with the situation here.
Becca, I don't know if it's just me, but I can't hear you currently. I don't know if something happened with the mic, but it's still not going through.
Can you hear me now?
Yes.
Okay, cool. Bluetooth is a fun time, guys. So, these are some of the areas that I already talked about. Should I recap depending on when you guys lost
Yes,
audio?
please.
Okay. Give me a second here. And then it looks like I'm not even hearing you right now, so that's awkward.
Did you say go to the next slide?
Okay, should be good now. So areas of concern that we've talked about, they've recently moved out, needing to pay bills, just housing needs in general, inconsistent income, physical needs like food. So nutrition and mental health is a fantastic conversation today with this case. Can you still not hear me? Or are we good?
No, you're good. We can hear
Okay,
you.
cool. And then also maybe childcare while working late on weekends. Some of those concerns come up. If you want to switch to the next one. So, questions I was hoping to talk with you today. Just three questions that sounds like we can maybe do breakout rooms for. But with this, community resources for managing budgets and finance problems, community resources for like physical needs for food, and then options for childcare potentially, and balancing work. That's kind of the bare bones of it. That was the thought I had with it. I'm gonna open it up to what we want to do next with that, though.
Perfect. Thank you, Rebecca. With that being said, I think we're good to move into breakout rooms if Janelle, you want to open them. Welcome back, everybody, officially. I know our breakout group had some great conversations. I want to open up the time to hear from our hub members. So I know that we had Heather M running a breakout group. Do you want to tell us what you guys talked about and what resources you guys thought of?
I'm going to turn it over to Kurt. He took our notes for us. Yeah, so I'm going to let him pull from his notes.
Yeah. So Stacy had a really good point. We talked about a lot of resources. There's a ton of resources out there. And we took the question around childcare and helping balance a paycheck and that. Lots of resources out there, but one of the keys we've got to really focus on is a lot of times parents are overwhelmed and don't have the capacity or don't have the bandwidth to just deal with it right now. But some of the resources, there's Department of Workforce Services in Ogden, where Stacy's at, they have the YMCA. USU Extension has a ton of resources around, childcare and around co-parenting and around nutrition, whatever the case is. So the USU Extension website, and I put that in our notes, has a lot of information. Also, the Utah Parent Center, the Office of Child Care, a lot of these places are great resources. But the point I think that we wanted to drive home is that when parents don't have the capacity or bandwidth to be able to handle this, there are organizations out there that will help walk them through, like the Utah Parent Center, like the Office of Child Care. They can help walk parents through that and get them connected with resources that are helpful more than just having a website.
I love that. Thank you for sharing. I also know that we had Heather W in a group. Would you like to share with us what you guys talked
I will.
about?
Sorry, I was talking and I realized that I was on mute. So
Okay.
we talked about resources that are available for meeting physical needs like food. So we had a conversation a little bit about, again, food insecurity, and a lot of great resources surfaced. We talked about WIC, SNAP, the Utah Food Bank. We talked about mobile pantry programs, Meals on Wheels, Tabitha's Way, 211, the USDA Hunger Hotline, Feeding America, their website, community gardens, as well as, let me see, some community fridges. So we talked a little bit about just neighborhoods and communities literally opening up their fridges, right? For families that reside within their neighborhoods and communities that are experiencing food insecurity, that they have a safe place to go, a place they're comfortable going to get food. Let's see, we talked about the Feed Utah project, farmers markets. So we talked about farmers markets and how many are accepting SNAP benefits. So, yeah.
Like both of you guys' groups had great conversations as well. I'm hearing amazing resources just from these like verbal lists, let alone like your actual collections and notes. Leo, since you did facilitate our breakout group, I can talk about what we mentioned, what things that we kind of brought up. I think an interesting point that we kind of talked about, we had the question on finances, is that it really kind of depends on like what area this individual is struggling when it comes to their finances. So we kind of talked about some resources that we have, like part of it, like doing with some of the things talked about with like food stamps, like WIC, PWS, as well as like some different ways. Sorry, I keep looking away because my notes are on a different screen. So I promise, guys. As like some different services like the Guardian and Conservator Resources, or GCS, like they're like helping with money management. If that's more of like an issue of like balancing a budget. And so we talked about a lot of different things like that. Another thing that was mentioned, I need to scan through my list to make sure I'm saying the right name. is connecting with community justice advocates and kind of going that route to get more help with like money and finding different places to maybe live or get that type of support. And then we also talked about grants that people could write for to get kind of help monetarily to help pay their bills. But I thought we had a lot of great resources, and I'm only naming a couple. That being said, all of these resources are going to be collected and posted to our Canvas page. They will also be gotten to Rebecca. That was a really weird way of saying that. They will be given to Rebecca, so you will have access to all of these as well. Just to like kind of wrap things up, we had a great conversation today with our case discussion as well as our presenter, Jenna. Our next session is going to be February 18th, where we're going to talk about acceptance and commitment therapy with Ty Aller. Very excited for that. Is there any other announcements that I should be aware of, Janelle? Perfect. Then I'm going to conclude this session. Thank you all for coming and for your comments and your questions. Have a good day.